A warm welcome to one and all. In this video, we are going to discuss about behavioral therapy. Behavioral therapy. Behavior therapy is the systematic application of principles of learning to the analysis and treatment of disorders of behavior. Definition. According to Reber 1987, behavior therapy is that type of psychotherapy that seeks to change maladaptive or abnormal behavior patterns by the use of extension and inhibitory process and positive and negative reinforcers in classical and operant conditioning situations. Many learned behaviors are constructive and adaptive. They help people to cope with daily challenges and to lead happy and productive lives. However, abnormal and undesirable behaviors also can be learned. Behavioral therapy evolved during 1950s. The pioneers of behavioral therapy were Joseph Wolf, Lindsley, Ivan Pavlov, etc. Behavioral therapy is now commonly used to treat phobias, anger issues, anxiety issues, sexual disorders, etc. Assumptions of behavioral therapy. Behavioral therapy focuses on behaviors rather than underlying causes. It assumes that both adaptive and maladaptive behaviors are learned or acquired from environment. It demands a specific treatment goal which was not present in traditional therapy. It depends on particular situations. It uses different techniques according to the client's problem. In behavioral therapy, mainly symptoms are focused, not the individuals. It follows here and now approach. It aims at modification of specific, overt, and maladaptive behaviors. Learning theory. Philosophical foundation of behavioral therapy is learning theory. According to learning theory, there are three types of learning process in which behaviors are learned. They are classical conditioning, operant conditioning, and modeling. Classical conditioning. Classical conditioning is a process of learning by temporal association. When two events repeatedly occur close together in time, they become fused in a person's mind, and before long, the person responds in the same way to both events. If one event elicits a response of joy, the other brings joy as well. If one event brings feeling of relief, so does the other. The key concept here is pairing. Behaviors are learned by being consistently paired over time with other behaviors or events. Example: being in the dark does not elicit fear. It pairs up with those stimulus which elicit fear. For example, horrifying stories. So, being in dark alone can elicit fear because it is associated with horrifying stories. The most famous example of classical conditioning was Pavlov's experiment with dogs, who salivated in response to a bell tone. Pavlov showed that when a bell was sounded each time the dog was fed, the dog learned to associate the sound with the presentation of food. Operant conditioning. In operant conditioning, humans and animals learn to behave in certain ways because they receive reinforcements from their environment whenever they do so. Behavior that leads to satisfying consequences or rewards is likely to be repeated, whereas behavior that leads to unsatisfying and unpleasant feeling is unlikely to be repeated. In operant conditioning, specific consequences are associated with a voluntary behavior. Rewards are introduced to increase a behavior, whereas punishment is introduced to decrease a behavior. Modeling. Modeling is a form of conditioning through observation and imitation. Individuals acquire responses by observing other people, the models, and repeating their behaviors. Observers are especially likely to imitate models they find important or who are themselves being rewarded for the behaviors. Behaviorists believe that many everyday human behaviors are learned through modeling. Imitation of heroes from movies are examples of modeling. The classical conditioning techniques used in behavioral therapy is system desensitization, flooding, and aversion therapy. System desensitization. This is the best known and most widely used treatment for phobic reactions. It is based on the simple principle that one cannot be both relaxed and anxious at the same time. In this technique, people make a list of fears and anxieties and then learn to relax while concentrating on these fears, starting with the least fear inducing item and working their way to the most fear inducing item. People systematically confront these fears under the guidance of therapists. System desensitization is often used to treat phobias and other anxiety disorders. Steps in system desensitization. The patient will be trained to relax completely. Relaxation techniques such as JPMR, mental imaginary, etc. are used for this. Then the patient lists the anxieties and lists them in the descending order of intensity. Then the client is asked to imagine the least frightening stimulus situation in that theme. The client is asked to think about it and then to relax and so on. The scene and the relaxation are counterposed several times. When the client indicates no anxiety, the next scene in the anxiety hierarchy is presented and counterposed with relaxation. Aversion therapy. This process involves pairing an undesirable behavior with an aversive stimulus in the hope that the unwanted behavior will eventually be reduced. For example, someone with an alcohol use might take and abuse a drug that causes severe symptoms such as headache, nausea, anxiety, and vomiting when combined with alcohol. Aversive techniques is based on principle that if a response is followed by pain or punishment, its strength will be weakened. It produces unpleasant consequences for undesirable behavior. Behavior change can be achieved by conditioning an aversive response to an undesirable behavior. This technique have been used in treatment of a whole range of maladaptive behaviors such as smoking, alcoholism, and destructive behaviors. Flooding. This process involves exposing people to fear-invoking objects or situations intensely and rapidly. It is often used to treat phobias. During the process, the individual is prevented from escaping or avoiding the situation. The operant conditioning techniques used in behavioral therapy includes contingency management, extinction, and token economy. Contingency management. This approach uses a formal written contract between a client and a therapist or parent or teacher that outlines behavior change goals, reinforcements, rewards, and penalties. Contingency contracts can be very effective in producing behavior changes since the rules are spelled out clearly, preventing both parties from backing down on their promises. Token economy. Token economies are based on operant procedures, and rewards are given for desirable behavior and not for undesirable behavior. Token economies are used in mental hospitals, training schools for delinquents, classrooms with students with emotional problems, etc. Rewards are given for desirable behaviors in the forms of coins, token, etc. This aims at reinforcement of desirable behaviors. Extinction. Another way to produce behavior change is to stop reinforcing behavior in order to eliminate the response. Timeouts are a perfect example of the extinction process. During a timeout, a person is removed from a situation that provides reinforcement. By taking away what the person found rewarding, unwanted behavior is eventually extinguished. Modeling techniques used in behavioral therapy are behavioral modeling, skill training, assertive techniques, exposure therapy, etc. Behavioral therapy can be utilized to treat a wide range of psychological conditions and disorders, including alcohol and substance abuse disorders, anxiety issues, depression, anger issues, eating disorders, panic disorders, phobias, etc. Behavioral therapy is problem focused and action oriented. For this reason, it can also be useful for addressing specific psychological concerns such as anger management and stress management. In addition, behavioral therapy has been found to help people with communication, coping strategies, healthier thought patterns, and self esteem. These are the references used. Thank you.